So the way you think that you don't have a good body and you want to go for BBL or liposuction, do you know it's maybe a disorder? Yes, it may be a disorder. My name is Obapeni Awojimfua. Today we are talking about body dysmorphic disorder, BDD. This is a disorder where a person has an intense or obsessive focus on his or her flaws in his appearance or her appearance. This disorder mostly occurs or happens in women more than men. So it can be a minor flaw or an imaginary flaw. They are just thinking, their focus is just on them. Maybe my shape is not good enough. My body, the way I walk, I don't like it. The way my legs are, it's all in their mind. So it can be an imaginary one. Or maybe a deformity. When they were born, they had maybe one leg not straight, or they had a scar during their childhood, and that resulted in that particular flaw. They become discontent of themselves, their appearance, and everything that comes with their body. Now, in trying to fix this deformity or this flaw, they can spend several hours, days, months, or years trying to fix it. And they end up financially spending on cosmetics or procedures or even exercise, excessive exercise, just because they want to fix the flaw. Let's look at the causes of BDD. There is an environmental factor such as childhood traumas or bullying or societal pressure. They were bullied in school that they were too fat, they were too slim, they had crooked legs, they are not beautiful, or their color, their skin color was like anything that comes with body shaming can trigger BDD. And societal pressure, that is the imaginary ideal body shape, can trigger BDD in a person. Or where the society feels that you have to be fair enough, your skin color has to be fair to be able to fit in, or you need to have straight legs to be able to fit in. You know, that societal pressure that comes with it, that you need to have a curvy shape, you need to have big butts, big boobs, and those things to be able to fit in, goes a long way in triggering BDD. Genetics. Person inherited it from the family, but there are some families that have this obsessive compulsive disorder, OCD. They are prim and proper. They want to make sure that everything about them is perfect or exception about their appearance, about anything related to them. They become perfectionists when it comes to their body. Brain differences. So it can be the structure or how the brain functions in terms of processing visual information or emotional responses. Personality trait. As I said, people with OCD are perfectionists. They want to look perfect in everything, including their body. So their personality can also cause or trigger body dysmorphic disorder. It's either they are perfectionists, their perfectionism is causing it, or they have low self-esteem. Symptoms: excessive examination of one's body in front of a mirror. So those people, they like standing in a mirror too much. Every second when they chance on any mirror, they would want to look at themselves to see if they are perfect or if they are okay, because they do not want to go out there and be looking some way and be looking a way that they are not comfortable in, or they feel people will laugh at or people will ridicule them on. So they spend hours or they spend minutes, lots of minutes or hours standing in a mirror trying to see if they are perfect or not. Comparison. So they compare themselves a lot. They compare themselves with other people. They see people on television and they want to be like them. even their own loved ones, their family members, their friends, they compare themselves. Why is Akosia looking, very curvy in this dress and I am not? They do a lot of comparison, and that results in the body dysmorphic disorder. They avoid anything social situations or photos because they don't even trust themselves. They don't trust the body that they have. So they would tell you, oh, as for me, I don't like taking photos, because they don't want to look some way in the pictures that you want them to take, and they don't want to see it. So anything that makes them feel less of themselves in public, they avoid it. They are always having an intrusive thought. Things are always running through their mind about themselves. This dress will not fit you. You don't look good. They are always having intrusive thoughts, things that are not supposed to run through their mind in connection or in relations to their body. They are always entering their minds because they are discontent with who they are. For the effect, they begin to feel overwhelmed about their thoughts, overwhelmed about how they appear, their body, and everything that comes with it. They avoid intimate relationships because they don't want they don't want anybody to come close to, their real skin, or to see what is inside the clothes they are wearing. So they avoid intimate relationship at all. They worry a lot, as I said, because they are always overwhelmed. They are worrying a lot, and it results in depression and anxiety. They have suicidal thoughts. They are mostly having suicidal because they feel that, okay, if I don't fit in the society, what is left of me? So they begin to have suicidal thoughts as a result of the depression and anxiety. They have this negative, persistent mindset. As I said, they are always having intrusive thoughts in their mind. So it's persistent. It becomes persistent. Isolation. They don't look perfect in their minds. They don't look perfect because of their flaws, because of their scar, because of whatever that is on their body. They will not go into public areas or social functions. So they isolate themselves from everyone. Treatment. Their major treatment is cognitive behavioral therapy, and they can also be treated on the line of psychotherapy or just a behavioral therapy. And most often, the major one is the cognitive. And then there's also medication. Mostly, they are giving antidepressant medication because of all the overwhelming feelings and everything and all that. Now, BDD, it can actually go, but there's any little trigger can bring it back. So for me personally, I say BDD is not curable, it is managed. Because the little trigger, you are back to where you used to be. So it can be managed. And as I said earlier, it is mostly found in women than in men. There are two types of BDD. It can be BDD by proxy or muscle BDD. BDD does not have a limitation. You cannot say that, oh, he's a child, so he doesn't have it. That's not BDD. It can happen to anyone from children to aged. So children from 4, 5 years above, it can happen to you. But when you are with someone and it is very intense, just encourage the person to see a therapist. Maybe there could be a solution for them. Thank you so much. I'll see you some other time. Bye.